summer treating you?
Summer is summering very well.
Okay. The topic of today is actually one that everybody has big dread about. They always ask me, even though they come to the heart doctor, they ask me about their kidneys. And we're going to be talking about kidney disease, something that actually strikes fear into a lot of people, and a lot of misconceptions about kidney disease and actually where the kidneys are located. It's important, first of all, to understand what these things are before we talk about where they are, because most people actually think they're in the wrong place. By the way, where do you think your kidneys are?
I'm thinking by my waist.
Exactly. It's exactly wrong. The kidneys are just under your last rib, behind your last rib, sort of midway between the shoulder blade and the last rib. It's very much higher up. And people point to exactly where you point, if not lower down, to say, you know what, I've got this really terrible pain and it must be my kidneys. It's not. It's usually your back. So it's much higher up than people actually think. And doctors often don't say anything. They just laugh inside themselves, say, ha, 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 okay. But anyway, the kidneys are two, everybody knows that the kidneys are two bean-shaped sort of organs that are located in the upper part of the abdomen, on either side of the spine. And it's really important to understand they play a really vital role in, I guess, filtering waste products and lots of fluid build-up in the blood. So when the kidneys are damaged or diseased, these things don't function very well. They're like filters, if you like, and this leads to build-up of a lot of rubbish in the system, a lot of poisons and toxins in the blood, and other health problems. So that's really important. And we actually have a rising number of people with kidney disease, often picked up early because we do blood tests, which can pick up very early signs of changes in kidneys. And in our country, there are very common diseases that cause kidney disease. And the two most important ones in Botswana are high blood pressure and diabetes. And these things really need to be taken seriously. We've talked about them before. And people don't realize the impact that sugar in diabetes has on multiple organs, and the kidneys is one of them. What happens basically is the sugar blocks up the kidneys, and eventually these kidneys die out, and you start having, vomiting and nausea and fluid buildup and swelling of your whole body that occurs in diabetes. And it's a really important issue that people need to prevent. So the two main types of kidney disease, one is chronic kidney disease, which is sort of going on and on and on and on as a result of diabetes or blood pressure or sometimes an infection, and acute kidney injury, which is something that happens, suddenly loss of function that can occur very rapidly. Acute kidney disease is caused by this time of the year, particularly in the elderly, where they don't drink enough, severe dehydration. You may be bleeding from somewhere, so you have a blood loss, infection, and of course certain medications that you may be taking for, cancer medication, antibiotics. And the commonest cause in this country of acute kidney failure is the abuse and use of painkillers. And the biggest one on the market here is ibuprofen or Brufen. And people use these like Smarties, because it relieves pain, particularly the elderly, and they have no idea that it impacts on the kidneys, never mind the blood pressure and the stomach and everything else. So if you're using these painkillers, particularly they're called anti-inflammatories, use them with caution and not every day if you can get away with it, because that's really important. Orthopedic surgeons or bone doctors love to give these pills for arthritis and for sprains and tears, but they come with a big cost. So please make sure that if you are diabetic, if you have blood pressure, and you're prescribed this anti-inflammatory painkiller, Brufen, Comprel, Miprodol, Grandpa, which people are still using and smuggling in across the border, are all famous for actually shutting down the kidneys. That's really, really, really important.
Even Grandpa?
Okay. Yeah. People don't realize it, because just like many of the other chronic conditions, kidney disease is silent. These kidneys are pretty hardy. Nature made them strong because we need to eliminate waste. So they take time to have an impact, and you really got to knock those kidneys. And you knock them by taking, a daily dose of Grandpa, or daily dose of Miprodol, or daily dose of whatever it is you're using for pain, whether it's, a backache or a headache or migraine or whatever it is. Be careful and be cautious. If you're using them regularly, it's worth asking the doctor, can I do a blood test to check my kidneys? Because they really are important. Make sure during this time of the year you're really well hydrated. Make sure that, if you have an infection that's ongoing, if they have affected your kidneys, if you had sepsis or pus somewhere, These are important issues that can cause acute kidney disease. But chronic kidney disease is the one that really disturbs us, and the ones that are piling up our list, where we refer to kidney doctors for dialysis, where we actually put them on a machine to wash their kidneys. Very, very, very expensive procedure, not common. There's a huge list, and unfortunately, once you're on a kidney machine, you have to wash your kidneys every 2 or 3 times a week. So you're bound to Gaborone or to Francistown, and now in Palapye there is a center. Other than that, you can't stay wherever you come from if you're out in one of the villages, because that's really important. And the 2 commonest causes of chronic kidney failure is sugar, high sugar, uncontrolled sugar, and of course uncontrolled blood pressure, which people don't take seriously. They think, I'll skip my pills today, or I'll eat this, cake or fat cake, or piece of sweet, and it really has an impact. Slowly but surely, it wears away your kidneys. So this is really, really important to understand that. And we've talked about this. If these filters are not working, it builds up a lot of fluid and a lot of rubbish in your system. So you get tired because of the toxins. You get short of breath because there's water bound up in your lungs. You get swelling of your feet and ankles. Your blood pressure begins to go up because the kidneys are very, very important in control of blood pressure. So that begins to occur. The urine begins to change color. It becomes sort of darkish color. And you keep going to the loo very frequently until eventually you don't actually empty your urine at all, and there's no urine coming out of your bladder. You get backache, that upper backache, not the lower backache that people think is your kidneys. And of course, because the toxins are building up, you lose appetite. So this is really important for people to understand. It's a gradual process, but it really kills you. And then by the time often many people come to us, they're in a state where the kidneys are already badly damaged, and we're doing now damage limitation, where we're controlling the blood pressure, we're controlling the sugar, but once the kidneys are damaged, it's very difficult to reverse kidney failure. So that's really important. There's lots to say, but I'm going to pause there if you have any questions.
I think maybe the question would be, how then do I know that maybe I might be having the kidney issues? Like sometimes I know that I don't know if I'm just going through a wrong path here, but sometimes I know that like symptoms where you can just see a person, I don't know how they see it, maybe the eyes or what. How can one easily notice that I think you should go to the doctor?
I think the most important one for me, that the best home test is your urine. If you're going frequently and the color is still normal, frequency of urination is a sign of something. It may be an infection, it may be diabetes, which causes frequent urination, or it may be kidney disease. If the color of the urine has changed from your normal color, which you know, it should be very pale. If it's dark, it means you're dehydrated. But if it's really dark, it's a sign that something's going wrong. And if you have kidney infections, there can be blood in the urine. It can be sort of a rusty brown color or even bright red. These are things that alert you at home. Look in the toilet pan to see what the color of the urine is. And if you notice these things, that's really important. Then, of course, if you are already diabetic, if you are already having blood pressure, if you are somebody that is an athlete that takes regular painkillers, we've talked about, be cautious. If you're taking supplements of any sort, please make sure they are certified and approved by the regulatory authorities. Don't buy over-the-counter things that you don't know anything about, particularly some of these compounds that come from places like China, where the information is not written in English and you don't know what you're taking, but somebody or your neighbor said, this is really good for whatever, you don't know what's in there, and it may actually cause a toxic buildup. The other thing in our country and in the region is people take lots and lots of traditional medicines. These mutis can actually even cause kidney shutdown. So please make sure you are very cautious of taking traditional medicines, or even some of these Chinese medicines. If you don't know what they are, they can cause these things. So that's the way to pick it up very early in terms of whether you have kidney problems. And of course, to prevent those kidney problems, there are a number of things you can do to prevent them. We've talked about that. Manage your diabetes or blood pressure if you have that. Maintain a healthy weight. We know the heavier you are, the more likely you are to have kidney issues because of the diet. Exercise regularly. People are tired of hearing these things weekly, but they apply to every single disease we talked about. Drink plenty of fluids. Get regular checkups with your doctor. So these are really important issues. We've talked about symptoms. We've talked about causes. And in terms of treatment, of course, if it's an acute issue, stop the acute injury. Whether it's lack of water, rehydrate. If it's a painkiller or some sort of antibiotic, make sure you attend to those and change them or go and see your doctor. If it's an infection, the infection is to be treated. If it's something else, the doctor will pick it up. So that's really important in terms of prevention. In terms of treatment, of course, it goes back to what's caused it. So if it's diabetes or blood pressure, tight control of those things. If it's drug-induced, we change the drug. Then if it's something that is chronic and the kidneys are really badly knackered and damaged, we send you to a nephrologist, which is a kidney specialist, that actually then decides what medications you can take. There are medications that can be used that are available in Botswana, both in the public and private sector, that reduce the progression of the disease and can protect the kidneys. And if you're not on one of those and you have kidney issues, ask your doctor about them. They are available. They're not very expensive, and they should be prescribed to all patients with kidney disease. So that's really important. Of course, eventually, chronic kidney disease does progress to kidney failure and dialysis. And in some situations, some people are lucky that they found a family member who will donate their kidney, and kidney transplants are increasingly common in our country. So that's really important in terms of treatment. So that's really important. I've got about 12 questions that have come in. I can answer them unless you have some questions.
I think you should go for the questions.
Okay, somebody's asked here, what's the fastest way to flush your kidneys? I think it's crucial to drink enough water, not juice, not fizzy drinks, because those things are poison. Both juice and fizzy drinks are just the same. You know, a can of orange juice and a can of Coke has got the same amount of sugar. So don't be fooled by thinking that you're drinking fruit juice. Drink lots of water so the kidneys can properly flush out any excess waste material, particularly in our climate, particularly as it gets hotter. This is especially important during a kidney cleanse. The recommended amounts of water are generally between 1.5 to 2 liters of water a day. Remember, there's some water in the food that you eat. So if you're eating a good portion of salad or maybe some fruits, they contain water as well. Somebody's asked here, what foods damage your kidneys? Good question. Processed foods, you know, things like hot dogs and sausages and frozen pizzas, frozen dinners, snack foods, condiments like, you know, tomato sauce, barbecue sauce, soya sauce. These things contain chemicals that can actually affect your kidneys. So be cautious about using artificial things. Always try and go for the natural one here. Somebody's asked a good question here. I'm not sure I can answer it. Remember, I'm not a kidney doctor, but it says here, how long can you live with kidney disease? Well, if you're without dialysis or a kidney transplant, kidney failure is fatal. You may survive a few days or a few weeks if you are in very bad kidney failure, but unfortunately, unless you're on dialysis, the average life expectancy is between 5 to 10 years on treatment and by management by a specialist. So that's really important here. Somebody's asked here, what is the best drink to heal kidneys? It's water. It's always water. You know, this is the most important thing. Forget about everything else. The green teas are helpful. You know, a little bit of coffee is also helpful, but water, it beats everything else. So that's really important. Somebody's asked here, what does kidney pain feel like? That's a good question. It actually feels like a dull ache. It's not a sharp pain. If it's a sharp pain, it's generally muscular or it's coming from the spine or the bones. It's a dull ache that gets worse when somebody gently presses on that area just below the ribs, in the middle, between, just under the shoulder blade. And it's often the only thing that causes acute pain in kidney, probably if you have kidney stones, which is not the subject of today's topic. Somebody's asked here, and it's a good question, but we've answered it, can kidneys repair themselves? Yes, they can, provided you treat them gently. These are really delicate organs, so treat them with care, you know, control your blood pressure, exercise, don't eat rubbish. If you're diabetic, make sure you don't eat too many sugary things. So these are really important things that can happen. One more question here is, always comes up, is lemon water good for kidneys? Well, some studies suggest that drinking lemon water may help treat kidney stones. It appears to be most effective alongside, you know, conventional therapy like Ciprostota and drinking lots of water, but not for kidney failure. Some strange ones we can answer if we have time. What fruits are good for kidneys? And that people ask these questions. Well, strawberries are very good because they contain two types of what we call phenols, anthocyanins and Elijah tannins. You don't have to remember these words. They improve kidney function. Cranberries, blueberries, raspberries, apples, grapes, all of them help. But remember, not too many fruits because fruit is a dessert, so that's really important. Let me see, I've got lots of questions here, but let me see if there's something interesting here. Here we are, one more question. What are the 3 early warning signs of kidney disease? I think you asked this question, but I'm going to answer it again. Here are 3 signs that could indicate that you're beginning to experience declining kidney function. 1, dizziness or fatigue. One of the first possible signs of weakening the kidneys is experiencing overall weakness in yourself. You just don't feel right. you don't feel well, you feel a little bit nauseous when you eat something, you don't like the smell of maybe oily food, you notice swelling of your ankles, you're going, the changes in your urination or the color of your urine are the most important things to prevent kidney failure. I'm going to stop there because I think we've run out of time, but do you have any questions?
My only question is for next week. What do we have next week?
You're on the ball today. Yeah, next week we're going to change topic altogether because we've had a lot of questions about some of the things that people are doing out there and, with these, what do you call them, health monitors, these Fitbits. You know, people are carrying them and wearing them on their watches and tools for measuring blood pressure and pulse and what we call artificial intelligence. We're going to talk next week and perhaps the week after about the advances in artificial intelligence and health technology that we can use to manage our health at home, which is the purpose of the Broken Body series, to manage yourself and to be your best doctor. So that's the topic next week, artificial intelligence and advances for medicine in the 21st century.
Right. Bye, Doc. I guess we'll be talking again next week. Saturday.
All right. See you next week. Bye.
Bye. It's 10:46 on Robert, your station of choice. That was Dr. Bhagat talking about kidney disease. Otherwise, we move. Coming up next, music of Asha.